athletic family, it's Jacqueline here, also known as JP. I'm an athletic trainer and I just wanted to make a little video to go a little more in depth regarding some of your back issues you might be having and why that might be. Our coaches do a really good job at helping us prevent injuries at our gym, but maybe this video can help shed light on why they're telling us what they're telling us. Especially in athletic people, back pain is very common, but it's definitely not normal. Pain is an indicator that something is going wrong. So we need to figure out the difference on if something's causing our pain or something's causing us to be sore. So in this video, I think it's important that we talk about form, mobility, and proper weight choice.
All right, let's look at the anatomy. What we're seeing here is your lumbar spine and your pelvis. What I think is most impressive about your lumbar spine is actually the fact that it's the only thing connecting the top half of your body to the bottom half of your body. It has a huge responsibility to stay healthy. Now, when we look a little bit closer at your lumbar spine, we're looking at the nerve roots that come out. You can think of these like Secret Service. They're protecting something incredibly important. When you're thinking about the other parts of your body, like your biceps maybe, that's more like a mall cop. It's gonna let a lot slide. You can get away with improper movement for a very long time before the mall cop's gonna crack down on you, okay? When it comes to the lumbar spine, you can abuse it, but you're gonna know really quickly. Now we're adding the musculature. What we're seeing here and here up by the spine is your iliopsoas or your hip flexor muscles. Okay, those attached to the lumbar spine, they come through the front of your hip and attach to your femur bone. These are going to allow you to do things like high knees. Okay, this is what we're using for squats and all kinds of movements, every movement. If these are really, really tight, you're either not going to get full range of motion in your leg or that spine's going to pull forward. These have a lot to do with back pain. Here's another picture that I think illustrates well that these are attached to each spinal segment. Okay, this is a really, really thick muscle. It's sometimes even called the human tenderloin. You have a muscle this big and powerful attached to your spinal column. On the other side of your body, we have our glutes. They are a group of 3 muscles, okay? Medius, maximus, and minimus. This group of muscles is really important when it comes to stabilizing your spine. Our coaches are constantly telling us to engage our core, engage our glutes. This is what they're talking about. It balances out the picture on the other screen where it was the hip flexors. In this illustration, it's going to show us what neutral spine is, an anterior tipped spine, and a posterior tipped spine. This is what I'm talking about when I'm talking about your hips being in neutral. Let's look at the pant line on the left-hand picture. Nice and neutral. If this was a cup of water, there's no spilling, okay? You have a nice healthy curve here that allows for proper movement. The discs have normal spacing. In the next picture, in the middle, anterior tipped hips, okay? Some water is gonna start spilling out of that cup of water. That spine is curved, forcing some of the pressure to come out the front of the spine. That's dangerous. We're pinching in the backside. This is probably due to either weak anterior core, tight hip flexors in the front, perhaps weak glutes. On the far right-hand side of the picture, we've got our posterior tipped pelvis. That's causing that spine to stand up really straight. Got some water splashing out the back of the cup here. This might be due to tight hamstrings, weak hip flexors. This one isn't so much going to lead to injury as much as it's going to lead to ineffective motion, lack of range of motion, ultimately allowing you to not move as fast or get your full range of motion. And then lastly, I like this picture because I think it, again, illustrates the coupling effect. So on the left-hand side here, on the back side, if this is tight, this is going to pull that forward, or backwards. Okay. If this is tight on the front hand side, hip flexors are tight, that's going to pull your hamstrings up and tip your pelvis. So not only does this have implications for your lumbar spine, but it can also cause you to have some issues with your hamstring or maybe even your knees.
Here we have 5 double stuffed Oreos, or 5 lumbar spinal segments. They're actually a really good representation of why it's important to have your spine in the proper position for lifting. Right now, they're stacked right on top of each other, relatively straight. A little too straight for the human body, but you get the point. If I press down on this, they're stable. If I give it a normal body curve like that, they're pretty stable. If I go ahead and give it a really big curve, this is somebody with really tight hip flexors, really tight hamstrings, weak core. I'm going to press down on that, and you can see that that spinal segment is tipping. This is a herniated disc. Now, when you're looking at a movement that isn't loaded per se straight down like that, like a back squat or front squat, we're looking at a kettlebell swing. Think of your spine like a crane. Does a crane have a really straight and rigid arm, or does it curve? Well, it's straight and rigid. That's the best way to get leverage. Same thing here. You can lift a lot more weight with a strong, stable spinal column. Okay, so here are our Oreos doing a kettlebell swing. Extension, flexion, extension, flexion. I can start moving it really quickly, and I have a lot of control over these Oreos. Okay, if I start to pooch them out a little bit into this poor position, it's hard to even hang on to because I'm afraid I'm going to herniate a disc. I have to even squeeze my fingers less tight because that's how fragile they are. And you lose your cookies just like that.
Now that we've taken a look at the anatomy, we can look at something basic like a squat. Where the first step is form. Our coaches are always telling us, keep our core tight, sit back, and keep our chest up. That's all around using efficient movement that's going to keep our spine safe. So if I keep my chest down, that's going to cause my spine to round forward. If I don't sit back in a chair, it's going to push my knees forward, which again puts my pelvis in a poor position. If I don't have proper mobility, like my hip flexors are too tight, it's going to do that anterior tilt of the pelvis again. If my hamstrings are too tight, it's not going to allow me to sit down deeply. This would be proper position for those hamstrings. And then lastly, being proper weight. If we're adding too much weight, more than our spine muscles can handle, it's going to force them to fall forward or to fall backwards like this. Now let's look at something a little more complicated like a kettlebell swing. Kettlebell swings tend to cause back pain more frequently than just a squat. That's because your spine, your Oreos, are acting more like a crane like you see at a construction site, rather than going straight down and straight back up. When you're doing that kettlebell swing, you're still using excellent form, keeping your chest up and your core engaged. Picking a good weight is even more imperative. As that weight comes further away from your body, if you cannot control it with all of these muscles, it is going to force that back to move forward. The repetitive nature of this exercise is what eventually leads to some of those injuries and that soreness that you might notice. So how do we accomplish all of these things? You should train in the position that you want to be in. Okay, so if you're somebody who's working on bench press, let's say, and you want to improve your bench press, you're not going to be just constantly doing things that are overhead here or only doing row. Eventually, you're going to lay down and you're going to be doing that bench press in the correct position. Okay. The other thing that we need you to work on is core strength. Okay. Always working on the musculature around here, low back, and in your pelvis in the position that you want to be in. You should be stretching things that are tight. Okay. So if you're preventing yourself from being able to accomplish that position because of your hip flexors, you be stretching your hip flexors more often. Proper warm up is important. Okay, you can't just throw your body into something and expect it to be able to handle the load that you're putting on it. And then lastly, all of our coaches are highly professional. and well trained at what they do. Listen to their feedback. They're there to help you, and they have a perspective on this that you might not be able to see while you're doing the movement.
To summarize the key points of maintaining spinal health, use proper form. Practice even basic movements with intention. Don't just fly through the warm-up. It's easy to get distracted and chat with your buddies. I missed that a ton, but use intention when you're doing these to maintain good form. Listen to your coaches when they're telling you to keep your chest up, and that maybe your feet aren't wide enough or they're too close together. Maintain good mobility. So stretch often, not just before and after class. The famous PT, Kelly Starrett, says if you spend 1 hour of stretching a day, you're spending 23 hours not stretching each day. So it does take a lot of diligence, but if you've got something that's really causing a problem, particularly tight hip flexors, spend a lot of time being consistent stretching those hip flexors. There's plenty of times throughout the day that you could fit in 10 minutes or so while you're doing something else stretching. Select reasonable weight choice. Be consistent going to the gym. This isn't always easy to do, but if you have spent some time away from the gym, ease back into your weights so that you don't get hurt. Do the prescribed accessory work that Aerial programs for us. This is intended to build strength so that we can accomplish our workouts at maximum efficiency. Thanks for watching, everybody. I really miss everybody at the gym, and I can't wait to see you all again. Feel free to reach out to me if you do have any questions about the video, and I'd be happy to help you.